Thank you. Hi, there's actually myself, Malky, one of our peer support volunteers, and I've got Sandra Holmes here from the Family Support Peer Naloxone Programme.
Welcome all of you.
So we've got all of us, we are 2 metres apart. So Sandra and I will move from the hot seat halfway through the presentation. So I thought I'll come on and just talk about how it came together, how we managed to pull together a policy so quickly. I think it was a 14-day turnaround from deciding we were going ahead with this initiative and how we got it off the ground. So we've got a really good peer support programme that's run for years by Malky within Midlothian Health and Social Care Partnership, hosted by Health and Mind, and we've always had fantastic peer-led family support group. For many years, Sandra's been very involved and we've all worked very closely together. Malky and I have had loads of conversations about peer naloxone. I've certainly spoke to Jason Wallace and certainly George and Kirsten in the past, and wondering how we get this going within Midlothian. And actually, just as COVID was coming around about a month ago, we've only been live about a month, it actually came out with 2 different families approaching. One was to SFAB looking for a naloxone kit over a weekend for their loved one, and whilst Sandra can give loads of support and advice, she wasn't able to actually distribute a kit, and had a very young gentleman who was opiate naive using starting to use opiates in terms of his stimulant use. We thought this family really need to be equipped with the information skills to use naloxone, and the gap was both of these things were happening on a Friday evening. Service provision wasn't there to provide that family with the tools. So you just pray that they're going to be okay, and that's quite a position for Sandra to be in. So we all got together and thought, how do we change this very quickly, and pulled together a way of delivering family and peer naloxone, because whilst these were people who didn't have access to kits, sometimes some of the people who are using drugs that aren't involved with services might not have that voice through a family member. So we luckily have some peers who are, some of them still in service, on treatment, some of them with us in other capacities. So we had access to people with living and lived experience that we could draw on to see if they wanted to be involved. So we quickly pulled together a policy and procedure looking at how we could make this work, given it was COVID. In Midlothian, we didn't close our doors, although we continued to see people. So we involved peers in the writing of what we called a service operating procedure. So it's Midlothian Health and Social Care Partnership, Sandra Holmes and Malky Paul. We've written this together to look at how do we do this in conjunction with people with living experience. We wanted to offer people who are still using drugs that might have less provision, going to the pharmacy, seeing services. We wanted to target people who maybe weren't in treatment. And when we were doing the training, some of the peers were saying actually some people don't want to go to a service to ask for repeat supply of naloxone for various reasons. That could be anything from child protection to maybe there might be a reason that they don't want people to know that they need a kit. So it was really just about doing it in a way that allowed people naloxone to be readily available 7 days a week to family members and to people using substances. And we also wanted to target people who may not be in treatment. So it's a case of if one of the peers has seen someone who's not on a prescription, that if they wanted to have rapid access to OST, this would be another route. And actually we had a higher intake recently of word of mouth referrals, so people haven't actually phoned up, but it's been someone using the services asked could we see one of their friends who are also using substances. So it's been really, really successful in trying to break all the barriers down to engage people who might find it quite difficult to engage in traditional ways. So we brought peers in, we did bring people in face-to-face for training. We have quite a big conference rooms and we have access to PPE. So myself and Malky delivered the training. Sandra had been previously trained, and it was very easy training because most of the people in the room had witnessed an overdose or have had an overdose. So they had quite good understanding of naloxone provision. And we set everyone up with a mobile phone with prepaid credit, as well as stamped addressed envelopes so that they could look at either postal naloxone if someone, so it's a case of advertised numbers, it's word of mouth. These mobiles are just for naloxone, so if some of the peers wanted not to be working that day or be involved in it to look after their own needs because their safety and well-being is paramount, they wouldn't have to do it that day, they have their own phones, these particular mobiles, were just so they know if that's ringing, it's really around peer naloxone distribution. We also provide the peers with all the PPE equipment, gloves, masks, anything in case if they agree to meet with somebody in a place with social distancing to distribute the kit. One of the peers who's managed to give some kits out might be able to talk about that. We also dropped kits off with Sandra at home, along with all the stuff she would require in terms of PPE. I'm just trying to think. So there's two options. You know, the peers, somebody can get in touch with one of the peers via text message or phone in. They'll phone back and arrange where and when they would want to receive that kit. They can also just say that they want to get a kit from number 11. They don't need to give any details of who that is, even just a first name. We don't take any data in the way that SFAD are delivering this, so that it's completely anonymised. We just count the amount of kits and maybe look at the geography of where we're getting peered kits, out to, but we're not taking any other data. And we hope to continue to look at every sort of area and hotspots and hopefully get some peers within more hostels. We've got one of our peers is in a hostel and target the other hostels, so there's definitely that peer naloxone distribution within some of the hostels where people are having near fatal overdoses, to make sure there's always that distribution. And Malky will want to talk a wee bit about how the peers are supported in terms of, we've got one of our peers who has given kits out, who might want to talk or not, or might want to talk through Malky, and Sandra will talk about how she's delivering it in terms of the family support element. So, hand over to you. Do you want to speak to that?
So good morning, I'm Malky. I'm the peer support coordinator in Midlothian, and I work across criminal justice, mental health and substance misuse. And for me, when first time I'd heard of naloxone was when I was on the addiction workers training programme with SDF, and I was thinking, why isn't everybody giving this out? Why isn't everybody supplying this? And here we are 5-6 years later, doing a conference like this and thinking, why is it taking so long? I did want to just pick up on what George had said this morning, that the policies need to be changed, and that's one thing that we're going to be sitting down and looking at, because we need to be having people who have got living experience for using substances to be giving out these naloxone kits, because they're the ones who are around people who are needing them. I can give them out to people who are supporting and stuff like that, but we want to be accessing people who aren't even using the services. So some of our peers who are still in the substance misuse field, still drug using, have got access to people who really need it. So they're saving lives right away. But some of our policies, you can only do peer support if you're 6 months clean, or a year free for substances, and that needs to change, because we need to be accessing and having everybody for different levels of drug use volunteering, so we're engaging with so many different people who are needing these. And like Tracy said, we've got the peers who come in, we've given them phones. For myself, we deliver peer support training, so I would like to deliver that to all our peers, giving them a stepping stone to be involved in numerous things. For the naloxone, one of our peers, the first day, within 2 days, he had gave out 6 kits. I've still got my kits sitting there because I've not been able to access anybody else. So that's 6 lives that are saved up right away. So I think, like George was saying as well, and George, hopefully maybe you could come up and visit us so I can come and visit you, because that would be awesome. Because your passion's tremendous and it's very infectious, and you're right, I'm a former drug user as well, involved in being in prison and things like that, and there's no difference between me and other people who are using services, but it just gives other people hope as well. So for the naloxone, having people who, I think even just giving them the opportunity to be involved shows that they matter, rather than the us and them kind of thought process around things. And I don't know if you wanted to say anything.
just I do understand that it's not been handed years ago, 10, 20 years ago. Why?
And our peers wondering why, like what I said, why this has not been happening for already, you know? Why is there so many barriers put up to be distributing this out to people? It should be everywhere. It's like a defib. It should be everywhere for people, you know? So we need to be making that happen. So I'm going to pass over to Sandra, and she's going to say a wee bit about a family support group.
Hi guys, I'm Sandra Holmes. I facilitate Midlothian Family Support Group. Hi George. This is a massive step for families. I don't think this has ever happened, that actual family members are being involved in Naloxone. Since this has been rolled out in Midlothian, I have a 24-hour helpline for families, and my phone has gone every single day. Yesterday it was 3 calls. I could be handing Naloxone out every single day just in Midlothian to family members. Now, they have family members that's using opiate. They may not know that their mum, their dad, their brothers or sisters have got a Naloxone kit in the house, but that's a lifesaver. I'm a mum, a heroin addict in recovery at the moment, but I've needed Naloxone and never knew I could have accessed Naloxone. Nobody ever offered me Naloxone when my daughter was actively using, and I lived every day waiting on an overdose for her to die, and I probably would have been able to save her life if I had Naloxone. We have family members that have lost family members and didn't have Naloxone in the house to overdose. So this is absolutely massive to the families to be able to access Naloxone. And as of the weekend, when all the pubs and clubs and beer gardens are opening, I'm going round with my husband. He's trained as well to use it. And we're going round the local pubs and beer gardens, everywhere that's at the local church that holds the NA meetings. I'm going round with the Naloxone kits to hand them out to the pubs, the churches, everywhere where there's meetings, everywhere where there's families that have got family members using. So I think Midlothian's going to be well and truly on the map with this Naloxone kit getting handed out. I've had 10 kits and I've distributed the 10. I'm here today at number 11 and I'll be taking another 10 kits away with me. And that's just me dealing with family members. So how big is this going to go? If we can promote this to this level, I think we're going to, the drug figure deaths, I'm dreading hearing what the drug figure deaths are going to be this year. But if we can promote this to a level that everybody knows what Naloxone is, we're going to save lives, and that's what it's about.